This segment of Delmarva Life is brought to you by Peninsula Home Care.
3 words that you hope you never have to hear. You have cancer. It is estimated that about 277,000 men and women will find out that they have breast cancer this year alone.
As if that's not bad enough, no 2 cases are alike and treatments vary, sending patients down a road of uncertainty. Well, if treatment involves surgery, patients can count on the help they need once they get home, thanks to Peninsula Home Care.
Jamie Musser is a registered nurse with Peninsula Home Care. She knows the importance of aftercare for patients going through breast cancer treatment, no matter where they are in their treatment.
We can be in next day. We can be in a week or 2 after. Depends on how long they stay in the hospital.
Once they do get home, the needs of the patient vary.
It just really depends on the type of cancer, if there's any lymph nodes removed, and what type of cancer it was, like the staging of it. But there's so many advancements right now.
Aftercare often consists of more than tending to the physical needs of the patient.
We're there for the, the social part of it, to just be there for the comfort, to just let them know, they're going to be okay, and this is what we're here for, to give them that support and the caring they need in that time.
And ready for what questions the patients may have.
I've had one person ask me if it's ever going to be the same again, is ever going to look the same again. And by the end of the treatment with that certain lady, it was perfect. She was so happy with the outcome of it and the services the doctor gave her and all the support.
Being out of the hospital doesn't mean not being looked after by a team of healthcare providers. Jamie says she and her staff communicate with the patient's oncologist, but she says it's important for patients to be out of the hospital and home.
Oh, I'm a big believer in being in the home. I believe that you heal better in the home. You get more support. That's your safe place. You're at lower risk for any infection. So you can be more apt to be yourself, to not have different layers of clothes on that could irritate any of the areas. I really believe in that.
She says patients can also rest assured knowing any complications that do arise at home will be addressed immediately.
We'll go in and we document, what the wound looks like. We have a whole template. It goes through and it asks if there's any redness, any drainage, any change. Some people, if there's any redness, you can actually mark around the incision site to see if that grows. And then we even go out as needed, if something's just not right or if something's changed.
For Jamie, helping a patient through this sometimes difficult time is rewarding.
Oh, gosh, it's wonderful. I mean, it's like by the end of it, they're like a family member to us, and it's actually sad, when it ends because you want to stay and you still wonder about the patients and how they're doing. But it's just an awesome feeling to be there from the beginning to the end, to know that you've helped someone get through a very difficult time in their life.
And it's no surprise, COVID-19 has changed everything.
The facilities, a lot of them aren't taking any admissions.
But Jamie sees that as a positive step toward recovery, one that may catch on.
So we're getting more complex patients in the home. And I do believe that, people are healing faster, people are more comfortable in their homes. And I really believe the COVID's kind of pushed home health care into a different perspective for a lot of people.
A perspective that may lead to getting better faster.
And the nurses at Peninsula Home Care also educate family members in patient treatment and medication management. Patients and caregivers can also reach out to Peninsula Home Care via telehealth if an issue does arrive.